This is Naomi Diaz with Becker's Healthcare. Thank you for joining us for today's webinar, Beyond Survival, How Rural Hospitals Can Build Future-Ready IT. Before we begin, I'll walk us through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. If at any time you have issues with audio or visuals, just try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I'm so pleased to introduce today's speakers, Phil Sobol, CCO of Cerecor, and Chris Reha, Principal Consultant at Cerecor. Thank you so much, Phil and Chris, for being here today. I'll now turn over the floor to Phil to get us started.
Wonderful. Thank you, Naomi, and greatly appreciate the introductions and the chance to speak to everyone today. So just to kind of level set here about the session and what everyone can expect from this. First off, we're going to explore some of those key IT challenges for rural hospitals. From cybersecurity risks to limited IT staff, and then some strategies to overcome those. But we're going to look to gain some practical takeaways from real-world examples, funding insights, and a roadmap for building a future-ready IT system that ultimately will improve care delivery and operational resilience. And as part of that, we're also then going to learn how leveraging the right partner can accelerate a rural health organization's path to modernization. So really excited to share this information and these stories with you today. So just a touch of context as to why this matters to us. So our organization is Cerecor. We are exclusively focused on the healthcare provider market from an IT services perspective. We were very intentional about our name. Cera being cerebral intelligence and core being core IT operations and systems for hospitals and health systems. And then one of the things that we were really focused on is that tagline, being the link to life-saving care. And that's something that we challenge each and every one of our employees to really be able to clearly articulate as it relates to their jobs and how their jobs impact patient care inside of our clients. Because ultimately, we become an extension of our clients' teams and partner with them in their missions. We focus on a wide variety of IT services, as you can see there, backed by a good number of certifications. But one of the things that I wanted to focus on really are kind of those, I wouldn't necessarily call them awards, but some of them are at the bottom. But really, those are the things that we're most proud of and focus the most on. And that is that our employees are very, very happy, very, very satisfied. And when they are, guess what? They do a fantastic job for our clients. And our clients are also satisfied as it results from the best in staffing, from the class results, et cetera. So just wanted to share that just really quickly contextually as to why we care so deeply about this topic that we're going to discuss today. So as we're all aware, rural health is facing a number of challenges. In fact, surveys are showing that about 20%, give or take, of all healthcare in the U.S. is delivered in a rural setting. And while the challenges facing healthcare are mostly universal, rural definitely faces some greater headwinds. And so, a few of those that come to mind, and I'll just touch on the list briefly. Limited broadband. We have clients in locations where, hey, either the one connection that they may be able to get is pretty limited. Understaffed IT teams with limited specializations, certainly high cybersecurity risks, financial constraints for sure, and that flows down into IT investments, outdated legacy systems, regulatory and compliance burdens, and cloud modernization difficulties. They all abound, and those are all challenging. So I'd love to just run a quick survey here, and there should be a Q&A box in the top left corner of your screens. If you wouldn't mind, in that Q&A, just simply put the top 3 numbers of those areas that are top of mind for you for 2026. We'll give you just a couple minutes for that. Excellent. A lot of common themes coming through here. A couple that weren't on the list. Very good. Outstanding. Excellent. Well, appreciate you sharing and participating with that. That's excellent. You know, today we're going to touch on a number of these and walk you through really some stories on how rural health hospitals have handled some of these headwinds and come out stronger and better positioned to serve their communities on the back end. And so to start us off, I just wanted to share a story about one of our clients that I was introduced to well over 7 years ago now. And we were able to come alongside them and partner. They're a rural hospital in Texas. And you'll see the picture there, and we'll get to it in a minute. But when I was first introduced to this organization, they were really struggling both operationally and financially. And just to give you an idea of the size of the hospital, it had just over 40 beds, but with an average daily utilization rate of only 10%, an NPR in the low to mid 300 million range, and under 200 employees. So as I was getting engaged with them, the board had just made a decision that the current leadership needed to change over, and they had brought in a new CEO and a new CFO. And the organization was truly struggling, as I mentioned, both operationally, but then also certainly from an IT perspective. That their systems were outdated, as you can tell by the picture. A bit of a mess in there. It would be probably gracious to call it a server room, but nonetheless, certainly challenged, and they were certainly understaffed from an IT perspective. Really, with at best what you could call the IT group is desktop support level. No governance in place whatsoever. No policies in place. And no path to modernization that was lined out. And so what you don't see here, I mean, yes, you see the spaghetti mess from a picture standpoint. What you also don't see is right there on the floor outside of the picture was this giant cardboard box full of retail networking gear that when something went down, the IT director at the time would reach into the box, pick something up, unplug one thing, throw it in the box, and plug the new thing in. That new thing could have been the thing that failed the week before. It was honestly that bad. And so we began engaging with the new CEO and CFO, providing them an assessment of their technology and options for a path towards modernization at their request. After getting to know their current team, because they were, new to the organization as well, they made the hard decision to let go of the individuals that was in the IT director role and hired us to provide IT leadership for them for the period of modernization that they were going to need to go through. So we worked hand in hand with the C-suite to put together a 5-year plan to modernization that would align with their needs as well as their budget. And, as everyone knows from a rural health standpoint, everything from a rural health standpoint has to go to the board for approval. And that can be challenging in a lot of rural health settings. The board is made up of the other local business leaders, whether they own the hotel or the restaurant or the local gas stations. That is typically the board, and almost none of those individuals are technology experts or really healthcare or hospital experts. And so as many of you can attest, getting that board to buy in is challenging enough. Getting them to buy into a multi-year technology transformation investment is no small accomplishment. But working hand in hand with the senior leadership at the hospital, that's exactly what we were able to help them accomplish. And so, while this isn't always the case, not everyone starts at this level. We had to start with the basics, as they had no standardization, a network that was out of date, out of compliance, hardware that was end of life or past end of life. In most instances, redundant, and retail licensing of software, and IT that just had disjointed buying behaviors with no controls. The server closet, as you can see, not up to code. Broadband deficiencies. They had trouble staying online. You get the point. There was a lot of work that had to take place, and that process to modernization and moving appropriate was a challenge. We started with cleanup. We started with plan. We started with what workloads can we immediately move out of the data center and into the cloud. We had to create and then get the organization to adopt proper policies and governance, and all of that foundational, given the budgetary constraints, given working within, not only the budget, but the team structure that was allotted. It took over 3 years to just get to that point. So part of rural, it's about plan, it's about leadership, but some of it is also about patience. And it was only after that solid technology and network foundation was in place that we were able to really address their antiquated and disjointed EHR and modernize their hospital and clinics to a singular platform. In this case, they went with Meditech Expanse hosted in our Cerecor data centers. The transformation took strong and visionary leadership from their CEO and CFO. And they realized they weren't able to do it alone with the talent that was available to them in their rural markets. And so really just wanted to share that story because it does touch on a few of the IT rural challenges that we discussed on the previous slide. But now I really want to turn the presentation over to Chris to talk to you about a few of those other challenges that we touched on at the top of the webinar. Cybersecurity, rural bandwidth, and funding insights. So Chris, the floor is yours.
Thank you, Phil, and thank you, Naomi. And most of all, thank you to all the folks who are investing their time into listening to this presentation. We hope to share some knowledge with you to make that a worthy investment. Just a little bit of background on myself. I've got over 40 years working in healthcare IT, and 20 of that has been in cybersecurity. The vast majority has been working in the hospital side. I'm currently in Southwest Virginia. I had worked with a large hospital organization here. We had 800-bed medical center, but we also had 3 critical access hospitals nestled in the Appalachian Mountains. So I'm very familiar with the challenges that these rural facilities are facing. If you look at the limited IT staff and cybersecurity expertise, cybersecurity expected to be a industry-wide phenomena, but the challenge in the rural facilities are they don't have the large labor pools that the urban areas have. And they also have a lack of cybersecurity policies and procedures. The folks that are working in the IT world are really focused on keeping the lights on, keeping the PCs and all the systems up and running. They don't have a lot of bandwidth to do the policies and procedures. And that's very helpful for organizations in the event that they do have a cyber incidents to refer to those. The other thing is, as Phil mentioned, the budget constraints means that the legacy systems and outdated infrastructure, that really leads to problems. And you really need to keep those systems refreshed. And the challenge is the longer you wait, the more expensive it gets because the deeper you get in those holes. Also, rural hospitals are viewed by the cyber criminals, the cretins that are out there, as soft targets. They figure that they're aware of the vulnerabilities. The federal government is well aware of the vulnerabilities of rural hospitals, and they've actually come up with a couple programs to help them. So the bad folks are aware of that, and they try and take advantage of that. And again, limited funding for a full-time cyber team, which really they don't necessarily need a full-time cyber team, but you need that expertise available on a basis for really maintaining your systems. So next slide, please. One of the things that we've developed in working with rural hospitals, and not just rural hospitals, obviously the focus of this presentation is on facilities, which are very resource constrained. But you know what? All hospitals are resource constrained. The challenges with the rural ones that I mentioned before are the labor pools, and but the urban ones have this as well. But what we've seen with all the organizations we've gone in there, our roadmap is really to do an assessment. Let's figure out where the organization is, how well they're conforming to the NIST cybersecurity framework and other frameworks. Work with them on policy development. We have a whole library of policies that we're able to reference and basically tweak for each facility, and then train the staff. That's a critical part, because the staff that are working in these rural facilities, they wear a lot of hats, and they're staffed very thin. We worked with one facility that we came in after they had a cyber incident, several months after they had the cyber incidents, and we learned through that process when they were working through it. Their one IT guy worked 3 days in a row. And to show you the way rural hospitals are so much embedded in their communities, when he was working those 3 days in a row, the folks at the hospital were actually babysitting his child. So they all pulled together. We also help them implement any type of new technology, as well as making sure they're aware of any emergent threats that are out there. Just today, as a matter of fact, from a regional rural authority, we got wind of an interesting phishing attack that uses Zoom. So I've got a listserv. I sent that out to all the clients that we have had, and we're talking with. Just as a FYI, these are some things you might want to be aware of. And then again, we work with organizations once we have the infrastructure in place to be able to monitor it and then develop the responses. We have incidents where we work with organizations to be able to provide that expertise to give them a timely response. And then finally, backup and recovery. We need to make sure whatever systems they have in place, they're able to back up and recover. We work with them on developing business continuity plans, incident response plans, but also a key component that we bring to these organizations is tabletop exercises. What tabletop exercises are, they allow an organization to find out where their gaps may be with certain scenarios in a very safe manner. And it does two things. One, it provides an opportunity for them to learn where their gaps are and take action steps to improve them. But also it gives them what I call muscle memory, so that in the event there is a real cyber incident, they have the confidence, hey, we've done this before in tabletop exercises. We know where to find the documentation. We know how to respond. Those are all really key components to the work that we're doing in these rural facilities. Next slide. Some of the examples we have of policies, and again, the folks that are working in these hospitals, they're busy just trying to keep everything up and running. They don't have a lot of time to put into the policy development and creation of these. We've come up with information security policies, access control policies, as I mentioned before. We're doing work with backup recovery, acceptable use policies. One of the things that's not listed on here that we're working with organizations is with artificial intelligence, AI. That seems to be a buzzword that a lot of organizations are looking at. That creates its own challenges from a cybersecurity and privacy perspective. So we work with organizations to develop governance for AI to make sure that it's done properly and it's done in a manner that will protect privacy for the organizations. The rest are kind of the bread and butter, the risk assessment and management, mobile device. One of the things that we've seen as an Achilles heel, not just for rural hospitals, but for most organizations, is third-party risk management. And some of the issues that are that happen with that. If we all go back to the Change Healthcare incident, that was a bellwether for organizations to take a look at their reliance on third party and how embedded they are in their organizations. So these are just some examples of some policies and procedures and expertise we can bring to the table to help these organizations. Next slide. An interesting example, as Phil mentioned earlier, bandwidth in a lot of rural hospitals is a challenge. There may only be one carrier, and that carrier can often be very expensive because it's that last mile, or in the case of some organizations that are in very rural areas, several miles to get that connectivity in place. What we've been able to do with one facility that was in the literally their claim to fame is they're in the middle of nowhere in Montana. They had one telecom provider providing them 2 internet lines that were basically running in the same pipe under the same parking lot into their facility. And just for discussion, those costs were about $1,000 a month. What we were able to come up with them, and that really wasn't any redundancy, even though they had 2 lines. They were both from the same carrier. They were both following the same path into their facility. So in the event a backhoe went into that parking lot and cut a cable, they cut 2 of them. But what we were able to do with them is work with Starlink. For those not familiar with that, that is a company that has satellite internet connection. Come up with their redundant or their backup system using Starlink at about 1/3 of the price of what they were paying for the redundant connection they had. So that was a very good win. And that's some technology we're actually presenting to some other organizations as well. So we come in with not only the expertise to take a look at what healthcare organizations in the rural areas and actually any healthcare delivery organization has, to take a look at where they have opportunities for improvement, help them with that improvement, and come up with creative solutions that are cost effective for them to help them move forward. Next slide. One of the things that we want to share with you is just some funding opportunities that are available to your organizations. I'm sure you guys are very familiar with the Rural Healthcare Transformational Program that the government is out there. It's $50 billion that are out there over the course of 5 years. And that's all done at the state level. There's a link here that provides information on that. And a good resource for you all to be aware of is the Rural Health Information Hub, which is out there. That is an excellent website that provides all sorts of information. And it's basically down at the state level where there's different links to the state organizations that there's different rural health organizations. As I mentioned before, there was a regional one that we're plugged in with out west that provided some information on the fishing thing, but they're also very helpful information sources for you all to take a look at it, how to tap into that funding. Also, the HRSA site has different opportunities that are available for organizations. A couple things that aren't listed on this slide. There's a CISA, which is a Federal Computer Information Security Agency. They have resources for healthcare organizations. As most folks are aware, healthcare organizations are one of the 13 key infrastructure that NIST has identified. And the government is working with those 13 key infrastructures to make them more resilient for cybersecurity. There's another grant program that's available for telecommunication costs, and that's the USAC grant. We've worked with organizations on that. That's been in place for a number of years. And that's an interesting organization. It's a quasi-government run organization, but they have funds that they have abundance of funds, is where I'm going to put that. If you look at any of your telecom bills, there's a use tax on home cable bills, home telephone bills. That money goes into a pool for this fund, and that fund has been woefully underutilized. So take a look at that if you haven't been able to dip into that. Another fund that SARACOR is working with is we just put a grant in recently for an ARPA-H grant for the resiliency systems offices. ARPA-H was signed into law in 2022. The Health and Human Services and the federal government realized how effective DARPA was as a way for the federal government to seed money that came up with really innovative and great solutions that were high risk but high benefit. So they funded ARPA-H. So we've just put in a grant for that to hopefully help rural organizations as we move forward with some of the plans that we have in place for that. And we'll certainly keep you posted on that. Next slide. So there are a number of different options. As I mentioned before, the Rural Healthcare Transformation Program, that $50 billion is all managed by the states. So one of the things that we've been doing a lot of research on here at SARACOR is funding opportunities based on the state level. And you can see that we've identified certain areas for the clinical information networks, the CINs, at several states. There's also a number of states that are looking at access and infrastructure and health information exchange. And those states are identified. One of the things that is in that law that they are definitely focusing on is improving cybersecurity for organizations. That's something that's ubiquitous in all 50 states. So again, that's something SARACOR is looking at ways we can help you with some of the grant development, application development, solution development to find out what solutions are available for you and cost estimates. And then best practices. We're tied in with a lot of different organizations. So we have ears and eyes that we can share that knowledge that we're learning from all these other organizations. Happy to do that with you. And then awareness of more opportunities. It's really nice when we go into an organization and we say, these are the things we think you should do to improve your cybersecurity or any of your IT infrastructure. And here's how we think we can help you with the funding for that. To me, that's the holy grail, because as we've talked about, rural hospitals are resource constrained. And I was thinking about this the other day. I don't think I've ever found a hospital that's not resource constrained, over-resourced. But it's really nice when we can go into an organization and say, here's where we can help you with fill the gaps that you have, and here's how you can pay for that. So next slide, please. And I think this is the right partner is really where we provide fractional services for your organization. We have the ability to do it. SARACOR or other organizations. If you think about it, a rural hospital doesn't need the expertise or the expense of a chief information security officer. However, at a full-time basis. However, you do need that on an interim or a fractional basis, and the same with some of the other services that we're able to provide, network services, etc. Strengthen the cyber skills that your organization has by training, recommending different systems, and getting the folks up to speed on that. We also can handle your communications with the board and senior executives that some of the local folks may not be comfortable with or may not have the expertise. As a matter of fact, in 3 hours, I'm giving an update to a board of directors of a critical access hospital that I've been working with for about 6 months. And they really appreciate the outside expertise coming in and basically assessing their own expertise, as well as helping to train their folks and making recommendations for improving their technology. We can work with them and share the expertise we have on their business operations and any of the nuts and bolts of running an IT organization or cybersecurity. So we also provide them the ability to, expand their capabilities and take them into places that they may not have had the expertise to, and recommend training, et cetera, for them. So we are long-term partners with organizations. So the organizations that I've been working with, we had one that we were working with for 5 years. The other ones, that's really what we're in this for. It's not just a hit and run. We want to become long-term partners. And CERACOR is very mission focused. We're looking out for what's best for your organization, not just at what's looking at best for our bottom line. So with that said, I think I turn this over to Phil again.
No, Chris, really appreciate it. And if you wouldn't mind, there was a question that popped up in the chat. The grant that you referenced that we've applied for, what was that grant again?
It's ARPA-H, and you could actually Google ARPA-H grants. It is a program that was funded in 2022, and there is money in there. The specific grant we put in for is for the Resilient Systems Office. That's RSO, and we're looking at a way to really streamline the process and making tabletop exercises a very affordable and easy tool for healthcare organizations to use. There's a lot of money that's in there, but a lot of it is actually spent on clinical applications too, but there is some technology money that is available in there as well. Great question.
No, appreciate it, Chris, and thank you for sharing that. Certainly there's a number of challenges, right? But at the end of the day, there are ways to overcome, and it starts with strong local leadership from a hospital and health system standpoint, and an ability to effectively plan and then put those presentations together in front of the board to make sure that you're moving in the right direction. So thank you, for certainly the time today. I know there was one of the questions that was posed at the top with, when I asked about the numbers, which ones are top of mind, and one of the individuals had said, "Hey, how do you develop our local talent, right? So that we can do a lot of this locally." And I hope that came across a little bit in our presentation today. When we come alongside, there's certainly areas where having a fractional resource with a specific skill set is great. Right. And it's one of those things that, really comes in and helps. But in the case of the example that I was giving earlier, where we were working with them from a 5-year perspective, well, part of that was changing out their internal IT team and then training them up on the proper way to run an IT organization in a go forward basis. So now they have an IT director in place that they're leveraging. From a local standpoint, someone that we were happy to help train up as part of that process. So hopefully that answers that question.
The other thing is we stay in tune with what's going on in both the federal and the state governments. And there is some pending legislation for the rural healthcare training opportunities that is going to focus on training folks technologically in these rural areas.
Indeed. I appreciate it, Chris. Well, we wanted to save a few minutes at the end for some Q&A. So again, the same box that you leveraged for the poll earlier, please feel free to drop your questions in there.
Thank you so much, Phil and Chris. Such a wonderful discussion. As they mentioned, we're starting the Q&A session. So audience, again, feel free to submit those questions via that Q&A box you see on your screen. And we're going to get started with our very first one, which asks, from your experience, where should a rural hospital begin if they have a limited budget but need to improve cybersecurity?
Phil, how about if I take this one because it's got cybersecurity in it?
I would hope you would.
Yeah. That's a great question, and thanks for bringing that forward, Naomi. The first thing to do is really do an assessment. As I mentioned in our roadmap, you really have to take a look at what you have to be able to know where you're going. And that's really where some outside expertise can come in very helpful for that, for identifying not only the gaps, but the particular funding sources you could use to help fill those gaps.
Thank you so much. Our next audience question asks, with rural hospitals facing increased cyber attacks and limited security staff, what are early cybersecurity controls should organizations prioritize to reduce their vulnerability immediately?
My recommendation is really to take a look at hardening your posture for ransomware. And a lot of ransomware is executed via phishing attack. And this is a really inexpensive way for organizations to be able to respond to that. They could be doing it with, just setting up phishing emails and training their staff to be aware of it. It's basically putting in place and educating what I call the human firewall, so that organizations and personnel working within those organizations are aware to think before they click on different emails. And that was the phishing attack that I mentioned earlier today that we got caught wind of from a regional rural organization. It was a really clever way that folks were sending out Zoom appointments and having folks, phishing to get people to connect to Zoom appointments. It's educating staff on that. That would be very helpful. And that's something that you don't have to spend a lot of money to do. And it has very good results. So really hardening yourself to phishing attacks, making sure your firewalls are in place, multi-factor authentication for any type of remote access, basically the basic blocking and tackling that most organizations are aware of.
Thanks so much, Chris. Another audience question asks, given that many rural hospitals still operate with aging systems and limited monitoring capabilities, what's the most common cybersecurity blind spot you uncovered during your assessment, and how quickly can that gap be addressed once identified?
From a technological perspective, one of the things I've seen that's common, particularly in rural hospitals as opposed to larger organizations, is the patch management. To get your patches out and do that in a very timely manner to fix any known vulnerabilities. A lot of organizations that have very limited staff, they try and get to it when they can, and they have it as a low priority, where in my opinion, that should be a much higher priority, because it really hardens your systems and it prevents a lot of time and angst down the line. So that's something. The other thing is too, as I mentioned earlier, is getting your policies and procedures in place, and not just doing it as a paper exercise to get in place, but to educate the staff as to what those policies are, where they're stored, and how to adhere to them. So really from a technological perspective, the patch management, and from an administrative perspective is get the policies and procedures in place.
Thank you so much. Another audience question here asks, can you say a little bit more about clinically integrated networks? How do you work with them?
I guess
yes.
I'll handle this one, Chris. I mean, I think it depends on the network. We have organizations that we do complete outsourcing from a managed service, IT managed service standpoint around service desk, around clinical application support, AMS, NOC, network operations centers. We also have our cyber advisory that plugs in there as needed, project work, along with anything related to EHR project work as well, for the three main EHRs that are out there today: Epic, Oracle Health, and Meditech.
Thank you so much there, Phil. That wraps our audience Q&A session. I want to say thank you to our audience, and thank you so much for the time today. Another huge thank you to Chris and Phil for an excellent presentation, as well as SteriCorps for sponsoring today's webinar. Thank you all for joining us today, and we hope you have a wonderful rest of your afternoon.
Thank you all.
Thanks.